Alright, I'm going to do the skin assessment. And there's Nala. I'll just turn it. There we go. Okay. Alright, so I'm going to be doing the skin assessment, so I'm going to say that I already swiped in. Hi, my name is Haley. I'm a student nurse from the Denver College of Nursing. I'm here to do a skin assessment on you. Is this a good time? Yes. Close the door, wash my hands, check the wristband. Let's get started. Okay, so first thing I'm going to do is I'm going to ask you some questions. Have you noticed any mole changes or abnormal moles? Okay. Any changes in your skin's texture, condition, color, anything like that? Okay. Have you noticed any hair loss or changes in your hair's texture? Okay. And any nail changes? No? Okay. Alright. So first thing I'm going to do is I'm going to put on some gloves. And I'm going to look at the head, but I can also touch the head while I'm doing this. So looking at the head, skull is symmetric. I don't see any lesions, no trauma, no abnormal masses. Hair color is brown. Condition is curly, it's healthy. It's not brittle, anything like that. Okay, that's good for that. So symmetric. Oh yeah. And I'm going to test if it's mobile, so I'm going to go like this. So the scalp is mobile, no tenderness with that, and no masses. Okay, so then looking at the face, I'm taking off my gloves, wash my hands. Looking at the face, face is symmetric, eyebrows are symmetric, eyes are symmetric, nose is in the midline. I don't see any drooping. What else do I want to say? Skin color is appropriate for genetic background. Hair distribution is appropriate for gender. And no masses or lesions on the face. Okay. And then before I move on, I'm going to actually look down here. So I'm going to ask the patient to lower their gown. I'm going to look at their chest right here. Looking at their chest, I don't see any abnormal lesions, no moles, or abnormal moles, no masses. Skin color is appropriate for genetic background, and hair distribution is appropriate for gender. I'm going to check skin trigger, so I'm going to look up. Good elastic recoil for the skin bilaterally. Okay, I'm going to cover you back up. Alright, so looking at the nails, nails are healthy, they're spoon shaped, a little bit of like dry skin on the end of the cuticles, but they're pink, they're healthy, they're not brittle or anything like that. I'm going to check cap refill on here. Hold down for 5, it comes back, color comes back in less than 2 seconds, so good cap refill bilaterally. Okay, so now looking at the skin of the upper extremities, skin color is appropriate for genetic background, hair distribution is appropriate for gender, no lesions, no abnormal masses, no abnormal moles. And then I'm going to check the bony prominences. So I'm going to ask the patient if they can lift up their arm, or I can do it for them. Looking in here, you're just looking for any like, I wonder what exactly you're looking for. I can't remember. Okay, so I look here, I don't see any skin breakdown. Look here, I don't see any skin breakdown. Look here, any skin breakdown here, here, and here. So I didn't see any skin breakdown bilaterally in the bony prominences or the intergenuous areas, posteriorly as well. So looking, I think I might do that after. Yeah. Okay, and then I'm going to check the lower extremity, so I'm just going to do it all the way down. I didn't do edema, so I'm going to check for edema. And then I'm going to check temperature. Temperature is warm bilaterally on both sides. And then I'm looking at the legs. Legs, skin color is appropriate for genetic background. Hair distribution is appropriate for gender. I don't see any abnormal moles, no lesions, no abnormal masses, anything like that. No ulcers on the lower extremities. Check for temperature. Warm bilaterally on both sides. Check for edema. No signs of edema bilaterally. Then I'm going to check cap refill. So press down for 5. Color should return in less than 2 seconds. Then I'm going to check the bony prominences. So for the lower extremities, I would look at the knees and then obviously the ankle. Looking at the bony prominences, I don't see any skin breakdown. And then look on the other side too. So no skin breakdown bilaterally for the lower extremities. Then I'm going to look at the back. So I'm actually going to have them, I can probably have her stand up for me. It'd probably be easier. So looking at the back, I'm going to look at like the scapula area, like that bony prominence on your scapula. And then obviously probably like here, like your tailbone. So just looking there, I don't see any abnormal, like no skin breakdown. Looking posteriorly as well, I'm going to be checking for, there's no abnormal lesions, no trauma, no ulcers back there, skin color is appropriate for genetic background, hair distribution is appropriate for gender, temperature is warm upon palpation, there wouldn't be any edema back there. And when I'm like assessing, when I have like Rebecca, if I do get skin, I want to make sure that I'm looking like anteriorly and posteriorly. So I'm going to make sure I don't want to like lift up her legs and everything. Okay, I think that's it for that one. Let me just make sure I said everything. I think I did. Okay. Alright, that one wasn't bad.